Hello everyone, I'm Professor Barbara Ryan. I'm a gastroenterologist and a clinical professor of gastroenterology at Trinity College Dublin, and I am one half of the gut experts.
I'm Elaine, McGowan, a registered dietitian. I'm the other half of the gut experts, and we are the authors of What Every Woman Needs to Know About Her Gut.
Welcome to this live stream with Fit and Well, and today we're going to be discussing irritable bowel syndrome, a common gut condition that affects up to 1 in 10 adults.
And we're going to look at all of the questions that you've sent in. Thank you very much for sending them in. The first lot of questions address some of your medical questions. Then we're going to move on to look at some of the dietary questions. So let's dive in. Barbara, first of all, I'm going to ask you, what actually is IBS?
So IBS stands for irritable bowel syndrome, and it's a common condition that affects up to 1 in 10 adults. It's 3 times more common in women than men, and it causes particular symptoms that affect the lower part of the digestive system. Those symptoms are abdominal pain or tummy cramps, and those pains are usually related to passing a bowel motion, so they can either be eased or worsened in some people by passing a bowel motion. It also can cause a change in the frequency of bowel motion, so people can go more frequently than often or have diarrhea, or people can become constipated, or some people alternate between the two. And finally, it can cause a change in the appearance of the bowel motions. So if you've ever seen the Bristol stool chart, some people can have small hard motions, or some people can have looser motions. So those symptoms need to be present for somebody to be diagnosed with irritable bowel syndrome. The thing about irritable bowel syndrome is that there is no test for IBS, because if you have IBS, standard investigations will be normal. It is important to do some other investigations to make sure there isn't anything else going on, such as celiac or Crohn's disease or colitis. This may involve some blood tests or stool tests, or maybe even some endoscopic investigations. But if you have IBS, all of those investigations will be normal, because IBS is a problem with the functioning of the bowel rather than the structure of the bowel. And it's now been designated what's called a disorder of gut-brain interaction, which means that it's affected by psychological factors and what's happening within our brain, essentially.
So could you just recap for me again, how common is IBS? Just those top two
So
statistics.
IBS affects 1 in 10 adults. It's 3 times more common in women. So 7 out of 10 people with IBS are actually women. And that actually boils down to it affecting 1 in 6 women.
Great.
So it's very, very common.
So 1 in 6 women are affected by it. And why are women affected by it more? Tell me.
We don't know all the answers to that, but certainly hormones play a very important role. We know that hormones, estrogen and progesterone in particular, in women affect the functioning of the gut. They affect how the gut moves, so they can slow it up or slow it down or speed it up. And they affect pain perception within the gut, so that if you're a little bit bloated or have some strong contractions, they may become stronger or more painful at certain times of the month. And the hormones can also affect the gut microbiota, the balance of the gut bacteria, and they can also affect perception of pain at the level of our brain. So estrogen and progesterone actually play a really important role in our gut functioning, and most women will be able to identify with the fact that during their menstrual cycle, their gut function may speed up or slow down at various different times. And similarly, women during perimenopause and menopause will also find that their bowel changes in certain ways. But we don't know all the reasons why it's more common in women than men, and we don't know all the effects of hormones either.
Yeah, it's fascinating.
It really is,
very much evolving. So tell me, how do you diagnose IBS?
So as I said, when you have IBS, investigations will be normal, standard investigations will be normal. So we try to make a positive diagnosis of IBS, not by just excluding lots of other things, but by the presence of those symptoms I mentioned. And those symptoms are abdominal pain or tummy cramps that are either eased or worsened, that are associated with passing a bowel motion, and either a change in bowel frequency towards diarrhea or constipation or alternating between the two, or a change in the appearance of the bowel motions. And you have to have those symptoms to be diagnosed with IBS. And then other investigations may need to be done just to make sure it isn't anything else like celiac or inflammation in the bowel, etc.
So we have another great question here, and this is, what is actually the gut-brain axis?
So the gut-brain axis is a term that's been used to describe the intimate connection that exists between the brain and the gut. And we know that there's a two-way, like an information superhighway between the brain and the gut. And this means that what's happening in our brain affects what's happening in our gut, and what's happening in our gut also affects what's happening in the brain. And the gut-brain axis is made up of the nerves that connect the brain and the gut. So that would include the vagus nerve, the nerve endings within the nerves within the gut itself, and other nerves that pass through the spinal cord back to the brain. It's also affected by hormones that can fluctuate very quickly, and also by the immune system, and all of those things are cross-talking all the time, and that whole system is called the gut-brain axis. So, you know, you'd all be aware of the fact that if you're anxious or a bit stressed, you may start developing gut symptoms like those butterflies in your tummy, or needing to dash to the bathroom, or maybe you might feel nauseated. And all of those things are due to the effects of the gut-brain axis. But the really fascinating bit is, apart from what happens in our brain affecting our gut, we also know that what happens in our gut affects our brain. So the bacteria within our gut, the foods we eat that can help feed the healthy bacteria, those things also can crosstalk back to the brain and affect our brain functioning as well. So our diet, for example, and our bacteria in our gut can affect our mood. So it's an incredibly evolving area, and we do not know or understand all the intricacies of it as yet.
Fascinating as well. And this question as well, I think we've answered a little bit of this already, is the effect of hormones on the gut.
So, as I said, estrogen and progesterone affect the gut in many, many ways. They can speed it up or slow it down. They affect pain perception. And not only does the level of hormones affect what's happening in the gut, but also the rate of change of those hormones that can change at certain times of the monthly cycle, can change quite rapidly. And cortisol is also another important hormone that particularly is elevated around perimenopause. That also affects gut function. And one of the really interesting things is that we know that women with IBS have an increased density of estrogen receptors within their gut, which might mean that they are more sensitive to hormonal changes than people who don't have IBS. So again, it is a really fascinating area,
isn't it? So interesting.
So we're going to move on to some diet-focused questions now, Elaine. And someone has asked, can IBS be controlled through diet?
Yes, so definitely IBS can be certainly helped, and the symptoms can be minimised through dietary changes. And there's a lot of easy, simple wins that we can look at first. So the simple wins are looking at your food patterns, some of the foods that you eat, and also some of the fluids that you take. So first up is the pattern of eating. And we know that many people today are looking after children, elderly parents, and multitasking. So if we start with the mouth, and chewing our food very well is really important, because we start digesting our food in our mouth. And what we need to do is make sure that we eat on a regular basis, we don't avoid meals, and that we certainly try to eat our food slowly. So it all starts with eating pattern first. And then if we moved on to look at some of the main top food triggers that can cause problems with the gut, like bloating and wind, and also sometimes pain in the gut, is really processed foods. So we know that processed foods, takeaway foods, and convenience foods often contain hidden ingredients like onion and garlic powder, and often they contain resistant starches, which are starches that go down to the gut. They're not properly digested, and while they can be good for many people, but with IBS sufferers, it can cause pain and bloating. So we advise people really to cook from fresh where possible, and for those that are really, really busy, maybe try and batch cook, and we maybe freeze some of those meals. We've a lovely Caroline chicken curry, lovely spaghetti bolognese that's gut friendly in our book as well. The next one would be really looking at fructose. So we know that people are advised who suffer with gut problems to eat about 2 to 3 pieces of fruit a day, as a lot of fructose in one sitting, which is really the fruit sugar, can cause a lot of bloating and wind. Artificial sweeteners like sorbitol, which is found in like sugar-free chewing gums and some diet products, can cause also uncomfortable gut symptoms. So there's some of the top wins. And when it comes to fluids, it's really important to make sure that you don't take carbonated drinks, such as even carbonated waters can cause bloating as well, and abdominal discomfort. And when we're looking at the other fluids like caffeine, it's important that you get caffeine just right, because we know if you're constipated, some coffee can help, and if you've loose bowels, too much coffee can be problematic. When it comes to these fabulous fruit juices and smoothies, for many people they can tolerate them very well, but for those that suffer with IBS, they can be a little bit problematic for 2 reasons. One, they often contain maybe too much fibre, and then also some of them contain too much fructose. So it's very much about finding ones that actually suit your gut. And then the other one really is alcohol, and we know this is a pet hobby of yours, Barbara, is that all alcohol can trigger gut symptoms, but to be particularly mindful of the lovely fruit cocktails that are available now, and that the fructose in these fruit juices can cause bloating, wind and uncomfortable abdominal pain.
So it's like a double whammy, a fruit cocktail with alcohol and the fructose from the fruit juices as well. And that just leads on to our next question then. If viewers ask, I've read about the flat gut diet, can you tell me more and how do I get started?
Yeah, so this is our dietary plan that we've developed, and we've used it on thousands of patients, and it's been very effective. So FLAT stands for, it's really easy to remember, they are the common dietary and lifestyle triggers that can cause gut symptoms. So FLAT, and I'm just going to go through what that stands for. So F stands for the 3 Fs. Fibre, which is very important, but it's important to get just the right amount of fibre for your gut. Fructose, which we just spoke about, and fructans, which is wheat, found mainly in wheat-based foods. L is for lactose, found in dairy products, and A is for alliums, onion and garlic. And they are the main food culprits that can cause gut symptoms. So it's very much about the quantity of these foods you take. And we've developed a unique point-based system to help you navigate the quantities of these that you can tolerate in our book.
That's spelled FLA. What's the T, Elaine?
So the T is for the total mind and body health, because we know that it's not all about diet. We need to look at that very important gut-brain axis. So T stands for our team's approach, which includes exercise, alcohol, mental health, and also sleep. And really a holistic approach to managing gut symptoms is extremely important.
Okay. Yeah. And there's one final question here. It asks, what about supplements? Are there supplements I should take if I have IBS? I mean, we feel, and I think the evidence would support that most people don't need supplements. The best way to manage IBS is through looking at dietary factors and trying to find the diet that's right for you. There's a lot of interest in things like fermented foods, and these can be included in small amounts to start with. Fermented foods are very healthy, but they can cause problems for some people because they can cause too much gas production within the gut, particularly something like sauerkraut, but may not be well tolerated. But kefir is generally very well tolerated. Probiotics is something that people ask about, and the evidence for probiotics in IBS is quite weak actually. Only 1 in 7 people would seem to benefit. But it would be, if you feel you'd really like to try a probiotic, it's very reasonable to try a multi-strain one. And the current British guidelines would be suggest that you try one for 3 months and see. But if you are going to try one, do your homework, see if the particular probiotic you're looking at has any evidence for benefit in IBS, because not all probiotics are the same and they all contain different species of bacteria. Vitamins and minerals, etc., generally you can get those through your diet. So I think diet is really the key, and then looking at the other holistic factors rather than being reliant on any particular supplements. So I think
we've run out of time now. So thank you very much for your fantastic questions. And this is our book, What Every Woman Needs to Know About Her Gut. And we've got lots of recipes, meal plans and tips to help you on track throughout the whole book. It's packed with information. And also we have lots of information on our website, The Gut Experts. And also we would love if you could join us on our Instagram at The Gut Experts.
Okay, bye. Thank you for joining us. Bye-bye.